Dr. Mayberry here. I am going to talk about the sacrum. So I mentioned in the lumbar vertebrae segment that the sacrum is going to be a little bit different. So the sacrum, for one thing, is fused. So these start in childhood as separate vertebrae, and they actually fuse throughout life. And in this individual, you can see these fusion locations. Usually it's 5 segments. It actually can be variable, and sometimes you actually see, it's called sacralization of L5. So in my lab at NTRIP, we actually have one of the vertebrae that has been sacralized. So L5 can actually fuse to the sacrum in certain circumstances, which we'll talk about when we talk about pathologies. So this is the sacrum. In some individuals, you actually still have little openings between the vertebrae. So this would be S1, S2, S3, S4, and S5. And then, of course, the coccygeal vertebrae articulate down here. So this would be L5. So that would articulate up here. So we do have superior articular facets that would articulate with the inferior articular facets of L5. So if that's on your lab practical, you can figure that out very easily. You can actually see on this individual, you can sort of imagine these being separate little vertebral segments. These holes are the sacral foramina, so foramen is a hole, so holes on the sacrum. And you actually have nerves that exit there that go into your lower limb. So we have that. These are the spinous processes for the sacrum. These really are the bodies of the sacral vertebrae. One of the landmarks that's kind of unusual is the ala. So alae is plural. Those are the wings. So think of these as wings of the sacrum. And on the ala is the auricular surface. Remember, the auricular surface articulates with the auricular surface of the ilium. So this is part of your pelvic girdle. And your book does put this in with the pelvic girdle. I have always separated it and put, because it is vertebrae, I put the sacrum in with the rest of the vertebrae. So here on Stan, we can actually see here is the sacrum, and here is the ilium, and they are articulating right in here at the auricular surface of each. Let me check my list and make sure that I've gotten all your landmarks. I have. Other than reminding you that because this auricular surface is articulating with the ilium, this is your sacroiliac joint, so your SI joint. So we will use this again when we talk about age determination especially, but we will be talking about it a few more times in the class. Okay? So we will have one more segment on the coccygeal vertebrae, and then that will wrap up our vertebral column.